Simon, welcome. Thank you. Now, why don't you tell everyone a little bit more about who you are and what you do?
Gosh, yeah. I mean, well, from the start or from now, I guess I mean, currently I have my own sort of business development consultancy. It's really only a couple of years old, and I probably wished I'd done it sooner, but I've had a long career before that, working for some major providers in business development marketing roles. Initially trained as a manager in the NHS, so I, always had this thing that, when you work in the NHS, you're working with lots of clinicians, and I never really had a profession to hang my hat on being a manager. So I found a profession which was marketing and sales within that, and ultimately sold my soul to the devil and worked in the private sector. So I worked for a few big companies, Priory, Hunter Combe. I worked for Castlebeck during its successful years, I must say. And also I've worked for CareTech in the supported living sector. And also I've worked in the private hospital sector in the med surg arena, providing with a company called Chartwell Private Hospital and Diagnostics, and they provide endoscopies, MRI services. So all what I've found to be specialist niche services. So I tended to develop my career around niche marketing and sales and focus in order to grow businesses. And, many businesses that I've been involved with have been private equity backed, and their whole modus operandi is about growth. So I've been used to working in teams where we've had to have a development plan, a plan of opening new services or opening new beds in an existing service. So you're adding growth, adding volume, you're adding revenue and margins too as part of that. So, I continue to do that work now in the consultancy that I've set up, working with a number of providers. And that is, again, my complete focus is helping them to grow, almost positioning myself within those businesses to be part of the team.
That's fabulous. And in fact, Simon and I actually met. That's how I first met Simon back in the Huntercombe group days, which was a while back for us anyway.
Yeah,
And Simon and the team that he was working with got me involved really, pretty much big time into the
yeah.
care sector. And I've been here ever since. So I owe a bit of thanks to you, Simon, and the rest of the team who we will know between
Yeah,
us.
exactly.
And
Yeah.
I so for and just as an aside, I was on my phone the other day. I was trying to ring another Simon, and it got through to this Simon Blunden, and that's how we spoke again after many years, and then we caught up and we see, and I realised he'd be a fabulous guest for this podcast. So such is the way things were. So
Yeah.
yeah, but anyway, it's great to have you back.
Thank
And
you.
certainly speaking with you again, and okay, well, thank you for that. Now, tell me, maybe a kind of good open-ended question is the way to start off with this one, is what do you feel you've learnt, for this, as we said from the top of the show, which is a niche sector, the specialist care sector, niche, what do you feel you've learnt on the, to help them, as they grow, expand, get more clients and on the marketing side?
Yeah, thank you. I have a couple of thoughts. Yeah, I used to work with a brilliant consultant, and actually prior to that, a manager who I used to work
Mm,
for always used to say to me, if you want to educate a consultant, let them educate you. And that I've kind of tried to do that in all of my
mm,
dealing with particularly consultants or senior clinicians in other organizations, and
mm.
just tried to listen to them, learn from them, to then be able to build my marketing plan strategies, business development, sales strategies around. And
Yeah.
that's, the consultant I mentioned, he was a medical director at Castlebeck, and he used to say, well, if it makes good clinical sense, then it makes good business sense. And I
Mm,
think that's always stuck with me, that, if you're gonna sell a story or sell a service, it's got to be based around the provision and the expertise that there is. And that expertise, doesn't always have to be deemed specialist. I mean, that can actually be fairly standardized sets of care. But actually, I've worked with some top quality care workers that, have real expertise in what they do, so why not harness that in some of what you do to promote your services? And so I've always just tried to just embed myself alongside those teams and make sure that, I'd say to anybody that's employed in business development roles or even, referrals and assessment roles within care home companies or care sector organisations, supported living companies, just embed yourself alongside those operational teams and be a part of it, and you'll learn to understand what makes those services tick, and
Mm,
also learn to understand what makes them hopefully work. For
mm,
some issues going in, is the outcome going to be good? And it's
mm.
about just embedding yourself into those services so you clearly focus and understand what it is that you can then pick up about them to promote.
Yeah, I see. So once you've kind of feel you're comfortable with those foundations and
Mm.
you've really listened to, as you say, the clinical team and the care or clinical expertise. How does that then move on to ensuring those people who you need to be reaching, I guess your target audiences, to to promote to them ultimately to win new clients?
Yeah, again, a really good question. I think, one aspect for me is being able to, well, I suppose first thing to say, it depends where I've been, at what stage in my career, because
Mm, mm,
things have changed, technologically things have changed
mm.
from my early days. It was, as internet was just becoming a thing,
Yeah.
everything was slow dial-ups and, email was
Mm,
just a thing and just a starting point. And
yeah.
so you were still operating through, in terms of marketing, you were still operating through sales meetings or, because face-to-face meetings were much more common then, and
Much more. Yeah. Yeah.
you actually get to meet people. It was,
Mm,
good, but the approaches were mail shots in the post and,
mm,
events and meetings to promote your
mm,
services. So, to now, today, things are so different, so you're using your websites, you're using your social media. Many people have got, and I use a platform, Maybe Tech, and it's just basically a platform that integrates the whole range of things for me, and it enables me to be able to keep my database in one point, my CRM. It
mm,
enables me to launch any social media, enables
mm,
me to launch any email campaigns. It enables
mm.
me to track and trace all of what's going on in the system and keep a record and be
Yeah.
able, so this is a mini CRM, but it also launches all of the that I do to kind of promote services.
Mm,
But
mm,
that's the sort of the marketing aspect, I suppose. But now, I still feel there's such a big role for the sales focus as well, the business development. Of a phrase which actually my daughter, who works in sales too, taught me, which was, be focused on who it is you're contacting. Do your lead generation work. So if you've got targets out there, whether they're in local authorities
mm,
or in integrated care boards, do your homework before you try to approach them, whether it's by telephone or
mm,
by email. I'd always recommend by telephone. I mean, other people are using video through things like LinkedIn or Instagram, and
mm,
really successful in being able to reach
mm,
senior targets, and
mm, mm,
I still prefer the phone method, but making sure you've done your homework and then you're fixing your days to work around when your targets are most available. So I typically will use a Tuesday and a Wednesday for
mm,
my phone calls, and literally, because I know people are at the desk. Mondays are not a great day, but other people will tell me Mondays is fine to get hold of people. They're
mm,
there. But I tend to use Tuesdays, Wednesdays and get on the phones to people and make sure that I've done my homework on the Monday before and be able to really, try and get through and get some meetings fixed. And I only find once you've done the homework on
mm.
them before you make that call, do you sort of resonate with them? I
Yeah.
think people can
Yeah.
be,
Mm,
lazy to that approach. Not lazy, but they've got lots of other things going on, so they can't always sort of do
mm,
that background homework.
mm, mm,
We're working with public sector organisations, whether it's local authorities or ICBs or trusts,
mm, mm,
and they all publish. They all publish their trust board data. They all publish their local authority public meetings or their board
mm,
meetings.
mm,
And so we've got good access to key information about them before you jump on the phone. They're all producing demographic data. They're all producing, data on their public health. So all
mm,
of the data on their deprivation statistics and so on. So you can use all of this data to help you target. And I mean, sometimes, and again, a phrase people have spoken to me about in the past is, you can use all the data that's there available, but you can also have sort of potentially analysis paralysis, which I like that phrase, where you're doing too much of it and not really getting down to the business. You've just got to try and find a few hooks based on the data that you see out there, and also corroborate that with your conversations, because I know I've worked in public sector organisations, and quite commonly the policy documents that they produce or the board paper documents that they produce doesn't always represent what goes on in reality in
mm.
those organisations. Their public face is published, but actually what goes on in reality in those organisations is very often not published. So
Yeah,
you do
yeah, of
need
course. Yeah,
to corroborate with the people
yeah.
you speak to. Is this
Mm,
correct? Is what I'm reading in your board papers correct? And sometimes things change rapidly over time. Again, I've worked in the NHS, and you thought you're on a pathway to one thing, and then suddenly the MP's on the phone about, your local MP's on the phone about, something that he's got an issue with, and
mm,
suddenly your whole policy and direction can change overnight
mm,
through
mm.
interference of somebody like your local MP.
Yeah.
Not necessarily interference. He or
Mm,
she is doing it for the best interests of the
mm,
patients, but sometimes it can influence and
mm,
change what goes on in reality.
mm.
But those are some of the things that I do. But it's generally, it's about being clear. Again, try and whoever your customers are you're working with, or in say your listeners' minds, who the organisations that they work for will be clear. Geographically, they'll be clear where they have their services and which
Mm.
areas they're targeting. I'm kind of lucky, and I say to people, I don't think there isn't an area in the country that I haven't worked with either their authority, local authority, or their trust, or the ICB or PCTs in the past, or even going back before that. Well, CCGs, PCTs were before that. So, but it's know your area, know your geography, and
Mm, mm,
know the organisations in those areas. I meet
yeah,
quite a lot of people who still don't know the map of customers that are in front of
yeah,
them,
and that's
especially
yeah, and that's odd,
those
isn't it?
that are
Yeah,
working,
yeah. Because tell
those
me,
that are working.
yeah, tell me if
Hmm,
I'm wrong on this, but essentially, if you're a specialist
hmm,
care provider and
yeah,
you're essentially you are getting referrals, your customers, your clients are, as you mentioned,
hmm,
NHS, the local authority.
yeah,
Um, So there's not an infinite amount of people. There's a very finite number of people. It might be a handful, from anywhere from a handful to a few dozen,
yeah,
maybe
absolutely, yeah.
maximum
Mm-hmm.
more than 100,
Mm-hmm.
but it's not, so you actually have a very finite number of people are on your, you've been talking here today
Yeah,
about phone and email on that list, essentially, and the research,
yeah.
who they are. You're not reaching 10,000 people.
No,
It's a
exactly. But
very finite number.
I've always been very focused on, right from the early days of my career, just creating spreadsheets
Mm,
of contacts, through to having a fully fledged CRM system now to almost automatically collect me the contacts that
yeah,
come
it's
off the
great.
websites that we
Mm,
use. So it's I know you'll do similar, and it's self-building lists is fine, but actually you do have to keep an eye on the targets, because not everybody is going to be coming through your CRM system automatically. So you've got to know who the key influencers are, especially if you're, working in specialist care services. There will be a finite number of commissioners either working in ICBs or
mm,
in, senior care manager roles within local authorities, or people within placement teams within local authorities that will have a particular expertise in one area
mm,
or another: learning disabilities, mental health, brain injury. You've got the whole subset of case
mm,
management
mm,
organisations as well. So it's absolutely fundamental
mm.
still to be fixated on your contact list, your
Yeah.
data face, and never neglect that. And don't just assume that because you've got a CRM that everything's fine and dandy. Just be constantly focused on it, and making sure it's regularly churned as well. People move around in posts.
Yeah. Oh, yeah. Yes.
Every day I'm finding new people for the businesses that I work with now that have
Mm.
just on their systems that are just not good targets. So it's
Mm.
about keep a focus on that, and that then helps your sales approach. And
Mm.
if you're not wasting time contacting the wrong people that are just going to tell you, well, either I stopped doing that job 2 years ago, mate, so I'm no good for you today, or people that will just say, oh no, she left now, so so and so's now in charge. But
Mm.
just keeping on top of that, and
Mm.
that's still a human task. You
Mm.
can't replace all of this with social media. It's not
Mm.
going to on its own. It's
Mm.
not continue to build your business. And you like I
Yeah.
said, need to know each organization in all geographical areas. I've been lucky enough to work for some very large national companies. Hunter was part of Four Seasons Healthcare, so
Mm.
enormous organization, very decentralized in its approach, actually, impressively so. Hardly any head office staff. Everything was delivered right through the care homes. A lot of large care homes were in Four Seasons, and they subsumed quite a lot of what used to be Southern Cross as well.
Mm.
And they still had delivery of management of referrals and their business development through the care homes.
Through
So
the, yeah.
all about having a big centralized team taking over
Mm.
running the show.
Mm. Mm.
I just think the kind of reason I mentioned that is because where it became hard for companies like Four Seasons was where you've got smaller operators that are totally geographically focused. They might have set up a small sort of mom and pop care home business in North Yorkshire, so
Mm.
absolutely knew their patch, and they could dominate it actually. There were a few good providers. I'd say North Yorkshire because one company people will know, Milewood, who were based up there, and they
Yeah.
used to keep really strongly just in there, because
Mm.
they absolutely mapped out their local area and knew all the key movers and shakers, and could concentrate and focus and build business, and they grew their business that way. So they gradually expanded out. Castlebeck did the same, started in the northeast, grew and grew and grew. But that original nugget of the northeast was its success, really. It grew from getting its, knowing focus its
Mm.
typical market. And
Yeah.
a lot of our segmentation I say segmentation, but a lot of my segmentation in the work that I've done has been around that geographical segments, or often age segments as well, because you've got children's services up to 18 to 65, and then 65, 75 and plus. So older age or working age, and that applies across all the different specialty areas. But I say that just be fixated on your geographical areas that you're working in, and know your markets as well as you can, and make sure your ops teams and everybody working within the business also understand those geographies. Not sure if that's helpful, but
So, in terms of so you have a finite number of target audiences, and we were talking about CRMs and emails and phone calls. I'm just
yeah.
curious on two questions. So, let's say you are speaking to a commissioner, let's say, very generically for the first time. A, do they answer their phones, number one, or how often can you get them via their phone? B, if you're having an initial conversation with someone who you don't know already, and you happen to get them on the phone,
Mm.
how do you conduct that conversation?
Yeah, I mean, again, really good questions. And I think in the end, it depends on what your initial contact data tells you. Have you got a mobile number for that person?
Mm.
I'd always strongly recommend, if you've got two numbers in front of you for a target and the one's a mobile, always phone the mobile first. You might think,
Mm.
oh, I don't want to interrupt them if they're in a meeting, or they're not, not at work or whatever. Always use the mobile phone first is what I
Mm.
would say. You're much more likely to get a pickup. You can
Mm.
leave a good solid mail as well as an alternative. And then how do you conduct it? I mean, it's literally, I mean, I read lots of people on LinkedIn giving lots of advice
Mm,
about how to do
mm,
this properly. And I still maintain it's about doing that homework before. So you've got something that you can pick up on
mm,
with them immediately, something that
mm.
you kind of discuss with them. I'm trying to think of a recent conversation. You know, we'd been in a meeting. Me and a couple of colleagues had been in a meeting with one commissioner, and you know, she'd given us some key data on you know, one of the trusts we were looking to try and work with, and you know, so I literally just jumped on the phone and said, look, this person has told me this, and she suggested you might be a good person to speak to. Can I just check that that's correct? And you know, it was numbers of patients being placed a long way away from their local
Ah,
geography.
yeah, I see.
So it was that kind of data that then led me to jumping on the phone with the commissioner, and you know, it was as good a place as any to start, and she could immediately give me an answer and have a, you know, start having a conversation and building it.
Yeah,
But it's trying to use that, you know, a referral is very good. So when somebody does, you know, say to you, oh, you should speak to this person about that, you know, then use that. So tell them that person said to speak to you. And these are kind of standard tools and techniques, really. I haven't got any magic,
yeah, yeah. But picking up the
but it's just
phone
doing
and
the
actually
homework.
picking up the phone and just calling is
Mm,
absolutely key here. So
yeah,
on the mobile phone, I would agree. Like always, mobile phone first. And just
yeah,
one of, I mean, because we have a sales person doing this for us, and
mm,
strategy we we use. If you call someone on their mobile, like
yeah,
if you receive a mobile phone from a mobile phone number you don't recognize, you're
mm,
probably not going to pick up. But
yeah,
you might, but if
mm,
it, and so what we do is that we'll phone once, that person won't pick up, we'll then
yeah,
immediately phone back. So then, let's say the receiver thinks, oh, maybe this is quite important.
yeah. Very
So then,
good, very
so
good.
then
Yeah,
you're
yeah,
more
yeah,
likely to pick up.
yeah,
So we
yeah,
always do that as a
yeah.
matter of course. And
That
I
is
tell you
brilliant.
what,
Yeah, again,
40% of the time they pick up
mm,
on the second time
yeah, that's
if they
great.
didn't pick up on the first one.
And my daughter taught me a trick. She said she had this in a sales company that she worked in, was just in terms of doing your calls. They said 9 before 9 and 5 after 5, because actually you can catch a lot of people before 9.
Mm.
Just, you know, a lot of people will start earlier just to beat the
Yeah,
traffic, get in at 8,
yeah,
sit for an hour and be available for an hour before their
yeah,
tranche of meetings might start.
yeah,
And the same after 5, you know,
yeah,
give it a try, you know, nine
yeah.
before 5 after 5. That was their target. 9 calls before 9, five
I
after
see.
five. And just be targeting
That's nice. Yeah,
a
yeah,
broader range, you know,
yeah,
and
yeah.
I just like that. I've tried it a lot, and you know, I've had some of my most successful calls lately through that
Mm,
approach,
mm,
catching people early. I
yeah.
tend works better for me. I'm much better. I'm a morning person, and that
Mm.
works much better for me too. So I can, why not?
And
Yeah.
what about this? We're talking here about phone. We're talking about email. What about other methods? I know you mentioned kind of mail shots, for example. So
Hmm.
meetings. I don't know. You could have invites to events, that kind of thing.
Yeah.
What
Yeah.
what kind of role do you feel that they play?
Still important. I mean, I think, you know, email marketing is still in its infancy and developing. You know, the tools
Mm,
and techniques and the software you can use
mm,
to send out huge
mm,
numbers of communications to people. But
mm,
it's choose your communication. You know, I was even listening to something yesterday when, you know, be careful about what fonts you might use if you're using email marketing.
mm,
Make sure there are clear calls to action, but don't use dark mode for some of your email campaigns. Make sure you're, you know, keeping it bright and pastely in terms
mm,
of
mm.
some of the segments. And
Yeah.
photography is another key thing at the moment. It's using images very effectively
Mm,
in
mm,
any emails that you might send out. I get reasonable rate of return on some of
mm,
mine. See, you know, you
mm.
say to, so you can see who's opened, you know, how many have been delivered in the first place, how many have been opened, how many have clicked through to your
Yeah.
website,
Yeah.
and you can see then you're traffic spiking on your web analysis
Mm,
anyway.
mm,
But is it generating referrals? And that's the bit that's often, slightly neglected, or it doesn't quite connect up with the great data you get off of, Google Ads, for example,
mm,
or just your Google Analytics generally. You get
mm,
great
mm.
data, but how does it connect up with the
Yeah.
reality of how many referrals you've got? Has that
Mm,
marketing
mm,
campaign been
mm,
effective for you? There's a phrase goes back years in marketing. Half of my marketing budget is wasted. I just don't know which half.
mm,
Yeah,
mm.
I still think that's the case today,
Yeah.
even with all the technology we've got, and we can
Yeah.
see how much it costs us for each click through these
Mm,
days,
mm,
from a paid ad or from
mm,
organic search.
mm,
But yeah, I still think all of us working in care sector services, I think we're all working on much more constrained marketing budgets and
mm,
sales teams than most, ordinary FMCG companies or other sectors, other fields.
mm,
They're much better set up. We're always having to do things on a shoestring
mm,
in care sector because we're paid diminishing returns
mm,
these days from
mm,
local
mm,
authorities in particular. The amounts are
mm,
going down,
mm,
not
mm.
going up with
Yeah.
inflation.
Yeah. Yeah.
So the marketing budgets are hit, so
Mm, mm,
can use free technology. There's some great free CRM systems. There's some great free HTML email generators.
mm,
Outlook itself. I mean, somebody says Outlook is evil, as far as email marketing goes, but Outlook has added a mail merge
mm,
system to its
mm,
platform. Just in the last year, it's
mm,
added a mail merge system, so you can potentially do things at a much lower cost
mm.
and be more effective therefore for your organizations.
Mm, that's
Yeah,
great.
I
And
do.
just one final question for me is on
Mm.
the face to face, the meetings and
Yeah,
seeing eyeball to eyeball, which I certainly do much less of that now, eyeball
yeah,
to eyeball, apart from on Zoom.
yeah,
But what role does that have to play in the specialist care sector, commissioners and those decision makers?
yeah. I'll always, I mean, we can get plenty of Teams meetings with key customers. That's easy.
Mm,
I'll always offer to, arrange it face to face in
mm,
person,
mm.
and rarely gets taken up, but
Yeah.
on occasion it does. And if it works, particularly geographically, if it's a meeting near to where I live,
Mm,
it's easier to
mm,
do. I do hunt down people as well. I mean,
mm,
lucky enough, I work in the hospital sector as well, mental health hospital, so I can literally sort of turn up at the Maudsley and find my way around and try and
mm.
track down people that I want to speak to.
Yeah.
And I do that, and it's just a matter of, they're not always that welcoming once they see you arrive. But I have some good contacts like that. I always carry a good box of biscuits around with me as well, so I've got something to give to them if they're kind enough to give me 5 minutes of their time, even in an unplanned. I call
Yeah.
them my on-spec meetings, because
Yeah.
but equally, I can turn up as I have done recently at Central and Northwest London Trust, and just anybody that I wanted to try and see just wasn't there, or wasn't available. So you can waste a lot of time and money doing that, driving around the country. But the other thing is to draw people in. I mean, care homes will be familiar with doing open days and things like that.
Mm.
I really kind of hate it when somebody suggests to me to do an open day, and there's the National Care Homes Open Week and things like that. But I kind of avoid those because in fact, what I try and do, if I'm going to do an open day, I'll do it 2 or 3 weeks before the open
Mm.
National Open Week, because I'll try and get it before everybody's sort of
Yeah,
maxed
it seems
out with it.
sense. Yeah, it makes sense. Yeah.
Try and draw people in with interesting topics. I've been successful with other companies with doing, CPD events, within the NHS in particular, where you're in the hospitals sector
Mm.
and specialist care home sector, I suppose, to run some events in your services to try and draw people in. Free events is good. you can't rely on everybody to turn up if it's free. But you know, I'm running one next month for one of our hospitals, and just the process of getting the speakers for the event has proven really beneficial because I've been able to get one of the key trusts that we work with. I've been able to secure consultant psychiatrist and a chief pharmacist to speak for us
Oh, that's
at
nice.
this event, and it's like a real partnership working
Mm,
then.
mm,
They're going to speak. I've offered them an honorarium fee. They've not taken me up on it. And it's just about, it enables me now to go out even further to the market and say,
mm,
oh, we're delighted to say, and it will be following on a LinkedIn very soon. I'm delighted to say we've got these folks agreed
mm,
to at our meeting. And I'm hoping that will double the numbers of attendees.
mm, mm,
So, and then when
mm,
you've got people captive, you can show them around your services.
mm,
I,
mm,
I use Eventbrite.
mm,
Just if you run a free event,
mm,
Eventbrite is free to use. So again,
mm,
I'm talking
mm.
about low cost solutions
Yeah,
for
yeah.
the care sector because we don't have a lot of money in our marketing
Mm,
budget.
mm,
So use Eventbrite, run some free events. Even
mm,
run some open days through
mm,
Eventbrite.
mm, mm, mm.
There's some amazing tools within Eventbrite itself. I mean, you can even pay to boost your event up a
Yeah,
bit. So
yeah.
you don't want to have to do that if you can help it. You make your event, interesting enough, then get people will book in. And
Mm,
it's so easy for
mm,
them to book. And then
mm,
the administration of the event on the day is so easy because you've got all your
mm,
data on Eventbrite and
mm,
you just literally run your whole day
mm,
on that system. Uh,
mm,
that's proven really effective for me at the
mm,
moment. And I'm sure there'll be so many other new technologies that will come
mm,
through down the line at us that
mm,
have to keep abreast of it, but not try and beat ourselves up sometimes because we see the use of AI and all this technology that's driving a lot of other businesses forward.
mm,
And I think just dip your toes into some of it, but just keep focus on the realities as well of
mm,
knowing who your market is, knowing who your contacts are, keeping your contacts up to date. AI is not going to help you do that.
mm, mm,
You
mm,
have to you
mm.
have to do some graft
There's
and
still
some
the human. Yeah, this
yeah.
human still has value. Yeah,
Yeah,
sure.
you can't just social
Yeah,
media your way out
yeah,
of it. You've got
yeah.
an occupancy problem in your care home.
Mm,
There'll be a number of reasons for that, and there's a
mm,
systematic approach to
mm, mm,
breaking that
mm,
down. What is
mm,
the reasons, and
mm, mm.
what is it we need to do to
Turn it
address.
around. Yeah.
I've worked on lots of CQC turnarounds as
Mm,
well. That can often be the point at which, you enter an organization and you're suddenly thrust into a sales or a business development or marketing role within a care home company. And it's like, here you go, here's a service, it requires improvement, and it's your job to sell it, and
mm,
it's
mm,
that's a
mm,
real challenge
mm,
sometimes,
mm,
depending on the nature of it,
mm,
even worse if it's just flipped from inadequate.
mm,
It's a
mm,
reality. It's a
mm,
reality of our
mm,
sector.
mm.
Everybody out there that's listening will have had
Very
that
familiar with it. Yeah, yeah.
exactly. You're not always having the best messaging to
Mm,
type out to your
mm,
selling.
mm,
Sometimes you're in a recovery position and
mm, mm,
hoping that CQC will come in and re-inspect and you'll get a good
mm,
rating and you can start moving forward again.
mm.
But
Okay.
I also have a phrase where I will never ever use the CQC rating as a reason why we can't sell a business.
Mm,
I
mm,
can't sell a service. It'd be the last thing I will point to
mm,
and
mm,
it often is the last thing that's
mm,
causing a service to have a poor
mm,
occupancy.
mm, mm,
So it's just try and work around it and try and be optimistic and again working alongside the managers of the homes and the ops teams, learn what it is that they've changed in their action planning that they've turned around and articulate that clearly to
mm,
customers
mm,
and or people you're trying to sell the service to.
mm. Okay, great.
Things, but yeah.
Simon, this is fabulous. Thank you so much for
Okay,
sharing
yeah, I've enjoyed.
your,
I've
yeah,
enjoyed. Yeah.
a lot of good insights. You've
Mm.
been doing this for a while, so you've the insights and anecdotes you've been able to share are fabulous. So thank you.
Yeah.
Just finally, if someone
Mm.
wants to get in touch with you to learn a little bit more, how best can they do that?
Oh gosh, I don't know if you can flash up my email address on the screen or my phone number. I'm on LinkedIn, so you
Okay,
find
well, that's probably a
Simon
great
Blunden.
Simon
Actually, there
Blunden
are many
LinkedIn
of
search. Yeah.
Simon Blunden's, but just as business development consultant on
Yeah.
LinkedIn. Look
Okay.
me up, connect with
Yeah.
me. There is another
Well,
Simon Blunden that works in the sector because my mum was a nurse lecturer and she trained another Simon Blunden, was one of her students. And she came home one
ah.
day. She said, I've got another Simon Blunden in my life. So I was a bit jealous.
All right. Well,
There
hopefully,
you
someone
go.
looking on LinkedIn will find the right one. So, but okay,
Yeah,
that's
that's it.
great. And
Indeed.
Simon, thank you very much for being a guest on the Care Home PR Marketing Podcast.
Thanks, Adam.